Hello everyone, welcome back. Today we will be going over ABGs, which is our arterial blood gas. Okay, the reason why we take blood from our arteries, usually the radial artery, is to see how well our patient is oxygenating. So for oxygenation level, plus most importantly to see if our blood is acidic or basic. And you'll see values such as PaCO2, PaO2, and SaO2. So Pa stands for partial pressure, and Sa stands for saturation, right? So SaO2 measures the percent of hemoglobin carrying oxygen, right? And the partial pressure in the arterial blood, it means that the pressure a single gas exerts while dissolved in the arterial sample, and the partial pressure is measured in millimeter per mercury. Okay, and now you have to remember, before we move on with the chapter, the two most important organs involved in maintaining our pH balance, right? So they are the lungs, because they are involved with carbon dioxide. And then second is our kidneys, and they are involved with bicarb, so HCO3, right? Remember the pH balance. Okay, so this pH, this value is our boss. Okay, so we are going to be focusing on pH tonight and how these two affect it. All right. We have to memorize the normal values. So the pH is 7.35 to 7.45. Carbon dioxide is 35 to 45 millimeters per mercury. Our bicarbonate level is 22 to 26. Our partial pressure of oxygen is 80 to 100. And our oxygen saturation, we all know, is 95 to 100%. Okay, so now if we have to interpret any of the disorder, right, be it respiratory alkalosis or respiratory acidosis or metabolic acidosis, and then we have metabolic alkalosis, we have to look at the pH number. I don't know why my pen is acting up. Okay, we have to look at the pH number, and we know that carbon dioxide is regulated by our lungs, and carbonate, our bicarbonate, is regulated by our kidneys. Okay, so when we say respiratory alkalosis or respiratory acidosis, is respiratory, so what's causing that disorder? What do you think? That would be our lungs, right? It has to do with the carbon dioxide levels. Okay, when we talk about metabolic, right, what do we think? It's the kidneys, so it's related to the bicarb. Okay, so remember that. So in this case, carbon dioxide is our acid, and bicarb is our alkali. All right, let's move on to the next slide. All right, everyone. Before we do the 5-step method, let's just go over the important stuff that we have to know. We all know that when the pH is below 7.35, our blood will be acidic, right? And if our pH goes over 7.45, our blood will be more basic, right? So our carbon dioxide, we said, was the acid. And our bicarb, we said, was our alkali, basically our base, right? Okay. So we have an acid and a base. Okay, so if the carbon dioxide level goes down, what happens to the blood? The blood turns basic. But if the carbon dioxide level goes up, our blood turns acidic. But the opposite happens with bicarb, because our bicarb is the base. So if our bicarb level goes down, the blood turns acidic, right? And if our bicarb level goes up, because it's our base, the blood becomes what? Basic. I want you to see a pattern. If you want to pause it and take a look at it and draw it out or write it out, feel free to do so. It will help, but just don't start panicking, okay? So let me explain this. Just look at the pattern, okay? So the pH and our bicarb, it's almost the same, right? So the value goes down, it's acidic. Same for it if the value goes down, it's acidic. The only thing opposite here is carbon dioxide. It's opposite to both. If you can see, we have a base if it goes down and acid if it goes up, okay? So kind of just write it down, take a look at it, take it in, and I'll show you how to do the 5-step method. So the first thing we're going to do is we're going to check the pH level. This is what we're going to do. We're going to check the pH level first, okay? We're going to see if the blood is acidic or basic. So basically, if the patient's blood reads less than 7.35, we're going to say that, okay, this patient is acidic. The blood is acidic. If we see that the patient's blood is more than 7.45, we're going to say, okay, it's leaning more towards the basic side, right? And then we're going to check the CO2 level. And then we'll check the HC, our bicarb level. And then we'll name the disorder. Is it metabolic? Is it respiratory? Acidosis, alkalosis, right? Where is it coming from? And then we will check for compensation. Basically, we're going to see the levels if the lungs or the kidneys are trying to compensate to bring the acid level back. So once again, remember, lungs, bicarb is from our kidneys. Okay? All right. So we're going to look at the pH first. We're going to determine if it's acidic or basic. Then we're going to look at these two values and see what's causing it. We're going to name the disorder, and then we'll see if either of the organs are trying to compensate. Okay, respiratory acidosis. Respiratory means what? Our lungs, right? Now we can see that acidosis would mean that our pH level is lower or higher. Obviously, our pH level is lower. What about our carbon dioxide level? We said our carbon dioxide acts as an acid, right? It's an acid. So is the level of carbon dioxide high or low for it to be acidosis? Obviously, it's going to be high, right? And when would we have a higher carbon dioxide in our body? When the lungs is not able to expel, right? When it's not able to expel it. And when would that happen? Is if we are either breathing slowly or having a difficult time breathing it out. So when we are hypoventilating. And that happens in a patient with COPD, patient with opioid overdose, or a patient who is sedated. Okay? As for respiratory alkalosis, our lungs are involved, right? And alkalosis, what does that say about our pH level? High, higher than or lower than 7.45 or 3.5. So it's obviously going to be higher, right? Our pH level is going to be higher. And what is our carbon dioxide status going to be? Is it going to be high or low? It's going to be low, right? Because now we have less carbon dioxide and more base, more alkali in our system. So when would we have less carbon dioxide? Now the lungs is still involved. Remember how we said hypoventilation? So here it would be hyperventilation. We are taking out oxygen faster than it should leave our body. So when someone's anxious, a person who's having a panic attack, someone in pain, or if they have fever, they will be hyperventilating. Okay, so remember this: RO, respiratory opposite, meaning if the pH goes up, let me erase this, write it properly. Oh. Okay, so respiratory is the opposite, right? Basically, if our pH goes up, the carbon dioxide level is low. If our pH is low, that means our carbon dioxide level is high. Okay? So respiratory problems are carbon dioxide problems. Happens in the lungs. Remember, the RO means respiratory opposite. pH and carbon dioxide move in opposite directions. Hypoventilation, COPD, and opioid overdose, it traps carbon dioxide. So carbon dioxide climbs and the pH drops, and it leads to respiratory acidosis. Hyperventilation from anxiety blows off carbon dioxide and it drops. So it blows up carbon dioxide, so our carbon dioxide level drops. And what happens to the pH? It rises, and we end up having respiratory alkalosis. So slow breathing is acidic and fast breathing is basic. Okay, now let's look at metabolic acidosis and metabolic alkalosis. So metabolic acidosis and alkalosis, we discussed, it happens in the kidneys, right? So the kidneys are responsible, and it's based off of the level of bicarb. Okay, so the first thing is, it already says acidosis. So what is our pH level? It's obviously low. And remember, we said our bicarb is our base. So would our base be high or low for it to be acidosis? It's got to be low, right? And when do we have, when does a patient end up with metabolic acidosis? So you want to remember DKA, which is diabetic ketoacidosis, diarrhea, renal failure, right? And shock. All right, so we have metabolic alkalosis here. Alkalosis already gives away that our pH level is high or low. It's high. And what about our bicarb, our base here? Would it be high or low? It would be high, because our blood is basic here, right? So, and what causes it? Vomiting, NG suction, and our antacids, having too much of antacids, because our antacids are made up of bicarb. Now, it's just a fun question. When, let's say, patient with GERD, too much acid in their stomach, what are they prescribed? Antacid, right? Because it's basically a base, and it kind of helps neutralize the acid. Okay, but you have too much of it, you can end up having metabolic alkalosis. Now, on the second box here, we have something written as me. So that's a mnemonic that you can remember for metabolic is equal. What does that mean? If you see here on this box, when the pH goes down, bicarb goes down. When the pH goes up, bicarb goes up. So it's equal. It's not the opposite. With the respiratory, it was opposite, and we said rho, right? For respiratory, we said rho. For metabolic, we say me. Okay, so just to go over it again, metabolic problems are bicarb problems. And so they are based on the kidneys. And me means metabolic equal. So pH and bicarb, they move in the same direction. You'll lose bicarb in DKA or diarrhea, and both drop, and it leads to metabolic acidosis. You vomit out of your stomach. So what do you vomit? You're vomiting out acid. So less acid, and the bicarb rises with the pH. And what do you have? Metabolic alkalosis. Okay, let's move on to the next slide. Okay, for compensation, we have 3 levels. We have uncompensated, partial, and full. So in both, we're going to ask, is the pH normal? So for uncompensated and partial, for uncompensated and for partial, the pH is out of range. Okay, so let's say the pH is out of range. We're going to ask, is it partial or is it uncompensated? If it's uncompensated, one of the values will be out of range. It's either going to be the carbon dioxide or the bicarbonate. So basically, the other organ is not helping out to balance out the acid base. For partial, the pH is out of range and both of these are out of range. So they're trying to maintain the balance, but they're not. So it's partially compensating. Now for full is that the pH is within range, right? The pH is within range, but both the values, both carbon dioxide and bicarb, is out of range. So it's the same thing as it happens with partial, but here they're out of range, but the pH is back to normal. So then we know that it has been fully compensated. So the body was working to get the balance back. Okay? All right, let's do a quick practice question. We have our pH as 7.29, carbon dioxide 55, and bicarb 24. So we'll take it one step at a time. Okay, first of all, we're going to look at our normal range. So for pH, our normal range is 7.35 to 7.45. Carbon dioxide normal range is 35 to 45. And our bicarb normal range is 22 to 26. Okay? Now let's look at it. What is happening? Our pH is 7.29, so it is lower than 7.35. So that makes it acidic. So acidosis. Okay, we're going to say acidosis. Now we're going to look at these two values and see what is wrong. So carbon dioxide value is at 55, right, which is way above 45. So our range here is because of carbon dioxide. So it is respiratory acidosis. And we're going to see if our body is trying to compensate. So we are going to look at our bicarb. Now our bicarb value is 24, which falls within the range, right? So in this case, it is uncompensated respiratory acidosis. Okay, that's how we're going to do our problems. We're still not done yet. We're still going to do a couple more. So let's move on to the other one. All right, let's do this problem. So our pH is 7.50. Carbon dioxide is 39 and our bicarb is 31. So let's work out with our normal range first. So 7.35 to 7.45. Carbon dioxide is 35 to 45. All right, and bicarb is 22 to 26. These are our normal ranges. Okay, so we'll see which one is out of range. So our pH is out of range. Is it acidic or basic? 7.50 is more than 7.45, so obviously it is basic. So we are leaning towards alkalosis. Now we want to know if it's respiratory or metabolic. What is causing it? Let's look at our carbon dioxide value. It's 39, so it is within range. So it's not our lungs, but our bicarb level is 31, so it is over. So this one would be metabolic alkalosis, right? And is it compensated, uncompensated, or partial? So carbon dioxide is within range. It's not really helping. So uncompensated. This metabolic alkalosis, and it's uncompensated. All right, let's do another problem. Okay, so we have a pH of 7.37, carbon dioxide is 52, bicarb is 30. Now let's do our normal range first before we move on. 7.35 to 7.45. Carbon dioxide is 52, normal range is 35 to 45. Bicarb is 30, but our normal range is 22 to 26. Okay, here you're going to be like, well, the pH is back to normal, so what are we looking at? We want to see where did it come back normal from, right? So we have 7.37. Is this range close to 7.35 or 7.45? Obviously, it's close to 7.35. So that means it was in the acidic state. So we are going to put down acidosis. Okay. Now we're going to look at the other values. Carbon dioxide is way off, right? It's more than the normal range. Okay. So it's 52. And bicarb here is 30. So again, it's more than the normal range. So what do we see here? What was the cause of acidosis? Was it a lot of bicarb, or was it a lot of carbon dioxide? Remember how we said carbon dioxide is our acid and bicarb is our base? So this level is up. So it was our respiratory acidosis. And we see that the kidneys are trying to work hard to bring the balance back, and they did. So that's why we're going to say that it is fully compensated. All right, everyone, before we leave, a quick recap. You always want to start with the pH. So you want to see if the blood is acidic or basic. And carbon dioxide is regulated by the lungs, bicarb by the kidneys. Carbon dioxide is our acid, and our bicarb is the base. All right, and remember Rome. RO in Rome is for respiratory is opposite, and the me in Rome is metabolic is equal. So respiratory, if our lungs are causing the issue, if the pH is up, you'll see the carbon dioxide will be low. If our pH is low, carbon dioxide will be up. And for metabolic, if our pH is up, bicarb is up. pH is low, bicarb is low. Keep practicing and you will get it. If you have to go over the video again, go over it, pause, write down notes. If this video helped you in any way, don't forget to subscribe, share it with your group of friends, and give me a thumbs up and leave a comment down below if you would like to see any other content. Have a good night and rest well. See you on the next video.